Laboratory values serve as a crucial diagnostic tool for doctors and nurses to identify potential health problems, monitor disease progression, and treatment effectiveness. Hello everyone, you're welcome back to my channel where I talk about nursing and health tips. This is Time with Nurse Joycelyn. If you are new here, kindly subscribe to this channel for me, like and share my videos, and then let your notification icons be on for new updates. Today's video will cover the basic lab values that every nurse must know. Let's get right into it. First of all, we'll get to know the definition of certain terms that pertain to our topic for easy understanding. One is hematology. Hematology is the branch of medicine that deals with the study of blood-forming organs, and blood disorders. It encompasses various aspects of blood and blood disorders, including blood cells, blood proteins, blood transfusions, and bone marrow. Some common hematological tests include complete blood count, blood smear, hemoglobin platelet count, white blood cell differential count, erythrocyte sedimentation rate, that is ESR. Also, blood clotting tests denoted PT, PTT, and INR. Hemoglobin is denoted HB or HGB, and hematocrit denoted HCT. Hematology is crucial in nursing as we always encounter patients with hematological disorders, and as such we need to understand hematological concepts for us to be able to interpret results and give appropriate care. In hematology, we have hemoglobin, that is HB, and the normal range for HB in male adults is 13.5 to 17.5 grams per deciliter. For female adults, the normal is 12 to 16 grams per deciliter. Any decline in these normal values should tell you, a nurse who is caring for this patient, that there's something wrong or there may be something wrong somewhere. So there's a need for you to report to your doctor or your in charge for an appropriate action. The normal HB range in children is also from 11 to 15 grams per deciliter, and then 14 to 20 grams per deciliter in newborns. Abnormal HB values can indicate various health conditions such as asthma and polycythemia, just to mention a few. And that is why I said earlier that a decline in the normal range or any changes in the normal range at all should be reported for appropriate actions. Hematocrit is also a blood test that measures proportion of red blood cells in the blood, also known as packed cell volume. It measures the percentage of red blood cells in the blood, like I said, and this helps us to evaluate the severity of anemia or polycythemia, and also to assess the risk of bleeding or clotting disorders. Hematocrit values, unlike the HB, vary slightly depending on age, sex, or altitude. The normal hematocrit in male adults is 40 to 54%, and then 37 to 48% in female adults, 35 to 45% in children, and 45 to 60% in newborns. When we talk of white blood cells, we know they help us fight infections. We have normal ranges for white blood cell count too. The normal range is 4,500 to 11,000 cells per microliter. Abnormal results can indicate leukopenia, that is low white blood cell count, and this also indicates a high risk of infection. An abnormal result that is also high indicates leukocytosis, and this also suggests an infection, an inflammation, or even cancer. Now let's talk about chemistry and get to know the sort of tests that can be written for patients and the normal values that is expected of them. Chemistry is the analysis of various chemical components of blood, urine, or other bodily fluids. So a patient can be asked by a doctor to go check on their sodium level. Yes, if they are checking the sodium level, then the normal range we are expecting is from 136 to 145 millimole per liter. Anything below this normal range or above this normal range suggests something else. If the result comes and it is lower than the normal range, then it is hyponatremia, which suggests that the patient is having too little sodium in their blood. However, if it is high which suggests hypernatremia, then it means the patient is having too much sodium in their blood, and doctors know how to treat them accordingly. If you are asked to check on your glucose, then we want to know the blood glucose level. We want to know the amount of sugar or glucose in your blood. So the normal glucose levels should be between 70 to 110 milligram per deciliter. That is if you haven't eaten. And less than 140 milligram per deciliter after you have eaten. Now let's talk about the abnormal results. If it is low, then there is hypoglycemia, which will result in shakiness and dizziness. So a patient goes to test for the glucose level and gets a lower result than the normal. She brings it to you and then you open, you see it. What you have to do is to quickly prompt the attention, or you alert the doctor in charge about it. You monitor the patient for these signs, that is dizziness and shakiness, and then you do the needful. The result can also be a higher value than the normal. That also depicts hyperglycemia. And with this result, you know the person may be having diabetes complications. So you also alert the doctor immediately, and then you take orders from him and do the needful. Next is coagulation, PTT, or partial prothrombin time. This is the average time it takes for blood to clot. Normal PT or prothrombin time is 11 to 14 seconds. Abnormal result can be prolonged PT that will indicate an increased risk of bleeding, or a shortened PT that also indicates an increased risk of blood clots. Still under coagulation, we also have INR, that is International Normalized Ratio. This standardizes PT results or prothrombin time results to ensure consistency, and the normal range is 0.9 to 1.1. Now, we may also see doctors ordering for tests such as ABGS. The full meaning is arterial blood gases, pH. ABGs, or arterial blood gases, measures the levels of oxygen and carbon dioxide in the blood and also the blood pH level. The normal range is 7.35 to 7.45. If the pH level is low, then there is acidosis. In this regard, there will be respiratory or metabolic problems. If it is high, then there is alkalosis. There will still be respiratory or metabolic problems. And that is why it is important to stay within the normal range. Patients can also be asked to do a whole lot of tests apart from what we've discussed today, be it kidney function tests, liver function tests, and others. But this is all for today. We've learned a bit of what nurses must know when it comes to lab values. Remember, knowing your laboratory values and knowing how to interpret them actually helps to give appropriate care to patients and also help with effective treatment. I'll see you in my next video.